And up next, we delve into technology impact on patients and healthcare systems. Leading this discussion are Noah Heymann, Deputy Director of the Budget Department at the Ministry of Finance. Noah, you're going first. The stage is yours.
Wow, taking the stage before Ran Balitzer in a biotech and health tech convention. This is how Britney Spears must have felt if she got the opportunity to be the opening act of the Rolling Stones. But don't worry, I've came prepared. Thank you, everyone. So my name is Noah Heymann. I'm not a pop star yet. I'm the Deputy Director of the Budget Department at the Ministry of Finance. And at the past 6 years, I've been in charge within the ministry on the budget, economic planning, and regulation of the healthcare sector. So what I wanted to talk to you today is about the adoption of technology. We all know technology is amazing. It's what moves us forward in almost every aspect of our life. But it is very challenging and very difficult to adopt. And I'll share some of my thought and reflection on why is it so difficult and what maybe we can do in order to change it. So we understand technology is important. We understand it's very difficult to adapt. And if there is one thing I want you to take from my presentation is I think we should start and measure ourselves not by how much our technology is sophisticated and advanced, but how well implemented it is into our systems, how well it is integrated. So my first thought is about incentives. Do you know when you have a great technology, it's evidence-based, the market fit is there, and still it's not fully integrated into the system? I want to suggest that when that happens, many times, it's because of misalignment of incentive between the different stakeholders in the ecosystem of health tech. And I'll give a few examples. Take home care, for instance. Home care is great, right? So many technologies, the market is evident, and yet, at least in Israel, it's not fully fulfilling its potential. One reason it may happen is due to incentive. Let's take hospitals, for example. Hospitals make revenue from every patient that is admitted within the hospitals. So if a patient would be at home care, revenues of hospital will hurt, right? So that is a misalignment in incentives. But if we'll change those financial incentives, we might accelerate the adoption of healthcare technology. Now, not all incentives are financial, or misalignment in incentive is financial. Sometimes it's ethical concern, sometimes it's organizational, okay? So we can take another example, which is remote monitoring devices for diabetics. Great technology, again, market, obvious. And again, it didn't made enough progress yet in adapting to our existing system. Why is that? Because it doesn't go well into the workflow of the physician. Physician needs to take a few more minutes and more operational steps, and it doesn't seem worthy enough for them. They don't see enough benefit from using the technology in regard to how much time they have to add or how many more clicks they have to press on. It's not in their workflow, right? So what can we do? Maybe we can change incentives. Now, people react to incentives. We can change incentive of providers, of physicians, of payers, of patients. And by doing so, we might accelerate the pace of which, or we might change the way people perceive different obstacles. We've done that in the past. We use our regulatory tools to shape incentive all the time. For example, we wanted to tackle the problem of ER. Okay? Our ERs are really, really crowded. And one reason is because the HMO don't develop enough alternative solutions. So if you're sick at night, you want to go to the ER, but maybe there are other solutions that are available as well. So what we did is we changed the financial incentive that the HMO sees every time it sends a patient to the ER, making it more worthy of them to develop those solutions, and it worked. So incentive work. We haven't used enough regulation and incentive yet in our system to try and advance innovation. And maybe we should dive deeper into it. And definitely, it is something that can accelerate adoption of new technology. The second point I want to make is about obstacles in adoption of technology. Now, there are many obstacles. There is poor data quality. There is data security, privacy issues, resistant to change, all of which are very, very tough obstacles to overcome. And we need to think how to deal with them. I'm not going to dive deeper into those obstacles. Instead, I want to talk about another obstacle when adopting technology, which is the overflow of the system. When you adopt the technology, many times it leads to an overload, and I'll give a few examples. The first one is telemedicine. Telemedicine everywhere got a major boost thanks to the COVID-19 pandemic. And in Israel, for example, the HMOs were able to move ahead and tackle a lot of barriers that were there before and adopt telemedicine technology. And this is great, and our patients are very satisfied with telemedicine. But there is one huge problem. Instead of replacing in-visit physician-to-patient meet, it added up more visits, meaning that now we have 10% more visits in total in our system. Now, again, maybe patients are satisfied, but physicians are not satisfied at all. They feel burned out. Now, think what is going to happen the next time we're going to come with a new technology to physicians and tell them, this is a great technology, come and adopt it. And they would say, well, if it adds to my overload, I don't want to use it. So by that, we make the next obstacles. And another question to be asked about telemedicine, when it added 10% more visits, so 10% more overload, did it improve the health by 10%? I'm not sure. Another example is genetic screening for healthy people. There are some providers in Israel that sells full genetic screening to healthy people that has no prior conditions. On the one hand, fantastic. This is the way to do advanced preventive medicine. If we'll check everyone and see whatever they may have and screen them every year and see in really, really early that they have something small and we can monitor it every year, that's great, that's preventive medicine. But on the other hand, think how much more overload we're going to put on our system if we'll screen every single person, a healthy person. I'm not talking about people who have a medical concern or medical history that needs to be monitored every year. But what would happen if we'll screen everyone every year all the time? We'll make more overload, and by that, we'll shift resource from healthy people, from sick people or people who are with more need to healthy people. Okay, so that's not a smart policy. Ever since the coin was invented, every coin has two sides. So technology is great, and we usually see the advancement of technology and the benefits of technology. That's one side of the coin. But always think of the other side of the coin and the overload it may bring with it. And we need to find ways to put, when we adopt policies and when we put new technology into our system, we need to find ways that would mitigate the pressure rather than intensify the pressure on the system. And overload is not unique to Israel. The final point I want to make is about simplicity. We're going to hear a lot of advancing, sophisticated technology in the next few days, and that's amazing, okay? But let's not forget that in every field in our life, and in healthcare as well, basic is important as well. And sometimes we can solve real issues by using really simple solution. Hand washing is probably the most cost-effective way to fight infections in healthcare. I only have 1 more minute. I'll invite you in this minute to be in contact with us. We haven't used, as I said before, enough incentives to make innovation run smoother in the system. So if you have any new ideas on how we can reshape the system in a way that would intensify the acceptance of innovation, we would be very happy to hear. Thank you.